Three, two, we are live and welcome back everyone to CBD with your favorite PhD. I'm Carmen Milagro, I'm your host, and with us every Monday morning is Dr. Katerina. Ooh, all right then. So we're just kind of laughing because, as you all know, technical difficulties and speaking difficulties sometimes happen when you're doing a live broadcast. But today's topic is actually very important. We had a question last week when we were addressing the topic of how CBD can help you during this COVID situation and how it can help with anxiety. But Al also had a question about how does CBD or can CBD help with chronic pain? Dr. Kat?
Hi, Carmen. Hello, everybody. I'm going to dive right in because this is such an important topic. It is our top 10, if not number one or two, questions that we get when we're on the road doing our CBD presentations or on the radio or the call-ins at the office. I'd like to start with providing you with statistics. I think it'll give you a broad scope. When we think about pain, we think about our own ailments, but also most recently in the last few years, we think about the opiate epidemic. And using opiates needs to be the last course of treatment. There's so much information out there. So Al, thank you so much for your question. It is a valuable question, and I think it's going to help so many people today. The statistics from American Academy of Pain Medicine, National Institute of Health, and the American Society of Addictions Medicine says that pain affects more people in the United States, get this, than diabetes, heart disease, and cancer combined. I mean, that's huge. I think everybody has experienced some pain. We are talking about physical pain. There's emotional pain as well. Today, we're going to focus on the physical pain. 4 million US adults report a lot of pain. 3 million adults suffer from pain every single day. We have lower back pain, severe headaches, neck pain, muscle spasms, migraines, nerve pain. One of the issues that we have been experiencing with CBD, as we mentioned, if you tuned in last week, is that people are not wanting to start a prescription medication. And we talked about the anti-anxiety medications that can be addictive. Well, wow. I mean, opiates and pain medicines are twofold. We have lost so many young adults and older adults from pain medication. So what do people do? They are asking about CBD and all their alternatives. Obviously, we know that there are other supplements. You know, CBD isn't for everybody, but it is what people are now learning more. There are statistics coming out every single day as we speak. It's been used for pain for thousands of years. I do have to say that physicians, because they have to go with FDA guidelines and what the pharmaceutical companies have studied, are still skeptical. And there are many skeptics out there. But the people who are using the CBD for pain are the people who are reporting amazing results. And it's different levels, and it requires different types of applications. So I want to focus in on the applications that can be used for the pain.
Thank you.
And please, Carmen, feel free to interject because you're on the road with me. Yeah. If you feel there's something that I need to stop and focus on. Okay. In regards to applications, people don't know maybe what they need to be doing. And so they call us and ask us how to use the CBD. Is topical better? Is a tincture better? Or, do I smoke it? Well, yes to all of those. And there's pills as well. There are so many new methods coming in. I even cook, with CBD to help, just with general health. And of course, it helps with the inflammation. It's personal. I do not recommend inhalation because of lung health. So what we use at the office is usually the topical and the oral, whether it's a tincture or a pill. We're going to have an entire different episode, Carmen and I, on how to use it, and we'll bring in samples for you. So today I want to focus on the understanding that there is a topical that you could put on. Carmen makes one of the best topicals, I have to say,
Thank you.
because what we choose to use at the office are organic, natural, pure, no toxins, third-party tested, full spectrum CBD that we know are effective. And I know Bourbon is that. The one thing that I love about your topical, it's an oil and you can rub it on a pressure point. You can carry, I always say I carry it in my purse, and I do. There are creams that people can use. A lot of people use the creams in large body parts. Some people use salves or balms. Whatever it is that you choose to use, I recommend you go both in and out. If you're suffering for pain, you can roll on the CBD onto your forehead. If you're having a headache, you can take the tincture under your tongue, which goes through your bloodstream and works faster.
Right.
All of these will help. How does it help? We know that CBD, there are studies that show that it is an anti-inflammatory.
Correct.
So it reduces inflammation. It doesn't hurt the gut. It has minimum side effects. It's safe. It's non-toxic. What I do recommend, if you're going to use CBD and you're going to use it as a treatment, that you contact us for consultations. We do CBD consultations. We have CBD nurse consultants at the office and myself, and we do a thorough history. We look at your labs and we try to find out how to help you based on what you want, what you need, and to start with the dosing process slowly. It is called pain management. Let's get off the opiates. Let's promote getting off the opiates. Let's look at our second course of treatment. We may have not mentioned some of your ailments around pain. Please don't hesitate to go ahead and send us any information or questions, or call at the office at 925-216-3510. We are here to help you. And let's see, Bourbon is amazing for neck pain. Fragrance is incredible. Rose, love it. We love you, Veronica. Veronica's one of our CBD extraordinary specialists. And we all suffer from pain. I'm not going to get specific. I know I have neck pain doing all this work that I do, and etc. Thank you, Veronica. And Carmen, thank you very much.
Thank you.
I want to end because we're 5 minutes nuggets and we can answer the rest of your questions. Good morning, Marie Ellen Varga. Is that your part, Carmen, that I'm reading?
That's okay. That's no problem.
I just have the information. You're the talent.
Right. No worries. No problem at all. I think it's really important. Sometimes we're going to go over 5 minutes because the topic itself is so important.
Yeah.
And, I wanted to sort of let everyone know that we're going to dive into all these different aspects. We're talking about hemp CBD, and we're going to really try to give you just small blocks of information to process. And you can string all these videos together and you can join us every week. So we're going to wrap this one up for today. Thank you, Dr. Kat, for the amazing information that you're able to just consolidate for us. But again, you can contact Dr. Kat and her team for more information on how CBD can help with chronic pain. We'll see you next week. Thanks again, everybody. And bye, Dr. Kat.
Quick note, consult with your doctor. They want to know. Thank you, everybody.
Okay.
See you next week.
Bye-bye.
Bye.